This is a recent MRI of a 12-year-old boy that has a previous history of surgical removal of hydatid cyst 2 years ago. The recent MRI shows a cyst that looks simple intraaxial in the deep part of the right parietal region. The fluid inside follows the CSF signal intensity in all the sequences. With no restriction. There is another small cyst just lateral to it. It follows the signal in both follow the signal intensity of the CSF in all the sequences. And it is surrounded by perifocal edema, and it shows pressure manifestations on the ipsilateral ventricle with a slight shift of the falx to the other side. That's the T2. The fluid looks simple and looks of the same signal intensity of the CSF. These are all the sequences. That's with the after contrast injection. There is only enhancement of the walls. And when we try to find a clue to differentiate it from an arachnoid cyst, the only clue is the inner membrane. When you look inside, you will see that there is a thinner inner membrane inside, which means that it is a cyst inside a cyst, which is very characteristic for arachnoid. That's the inner membrane. This is a well shown inner membrane. And the other lateral smaller cyst also shows inner solid component, which might be the scoliosis. So this is a recurrent hydatid cyst intraaxial in the right parietal lobe. 2 cysts. And there is some hyperostosis in the bone due to the previous operation, and a little amount of subdural hematoma.